I'm 1,000 days sober today, and I did not have DWI. I didn't hurt anybody. I didn't fail out of medical school. I wasn't a bad resident. I did pretty well in a lot of those things, but I was going down a dangerous trajectory that I think is very common in medicine that not a lot of people like to talk about. We see some terrible things in emergency medicine. We see people die. We see people have life-changing diagnoses. We see victims of abuse. And we use alcohol because it works. It slows down your brain a little bit. It helps you relax. A lot of people use alcohol because it works. It's very effective. And for me, it started in COVID, I think, because you're in lockdown. You're with people every day. You can't go places. But alcohol can help you go to less stressful places in your mind. But that has an effect over time when that becomes your go-to coping mechanism. And it was for me. And the thing that really hit home for me was when my wife and I were trying to have our second kid, and we stopped drinking, of course, because my wife can't drink and I'm her husband. I'm not going to drink without her. And I would say it's really hard not drinking every day, which was a big red flag, right? I come from a long line of people who have abused substances, going back generations. So genetics was not really helpful in that regard. But healthcare people, I feel like we are our own worst patients. Like if any patient came to me with that kind of sentence, there's an obvious reaction to that. But when it's yourself, especially when you're functioning very well in society, you're successful in your job and a hard career path, things like that, you don't really have that external stimulus that makes you stop. The first several weeks were very hard. The next following months were not hard at all. Look how productive I am. Look at all the stuff I'm getting done. This is amazing. I feel so rested when I wake up. But I feel like now as an attending, where I'm able to slow down, I'm still very busy. And I'm not technically working as many hours as a resident, even though it feels like I am. I feel like I am retroactively trying to make better coping skills for myself. Because even without drinking throughout residency, you can just work yourself into the floor. You can see that extra patient, do another procedure, do a research thing, go to chief resident, try to get an award. And that external affirmation can be very intoxicating as well. So it sounds a little silly, but I'm trying really actively now to just sit and be still with my own thoughts. I don't think I've really done that. I haven't given myself the time to. So it was challenging for different ways. But I think for me, sobriety, complete sobriety, was probably one of the best decisions, other than being a dad, in my adult life. Okay, have a good shift.